The information in this video is provided for informational and educational purposes only. Hey everybody, welcome to another edition of the Morale Monologue. I'm Michael Morale. Today, I want to talk to you about a subject that's been on the news for what seems to be forever, but I want to talk about the coronavirus and the impact that this coronavirus will have on those of us with SMA. You know, I live in the United States, and we've closed our borders to China, to Europe, and to Canada. And we're just trying to limit the amount of people that are coming into the country that could be carriers of the coronavirus, and to try to keep all of us as safe as possible. And this is happening throughout the world. I know that in Italy and all over Europe, it's much worse than it is in the United States. And I think while the United States may be in a better position with regards to the number of people that are carrying the virus, it's still something that all of us need to think about. I heard a topic the other day where they were talking about able-bodied people that catch this coronavirus. You know, they said that 80% of the able-bodied people that catch this virus probably won't even know that they have it. They'll view this as just similar to the common cold. They may have a little bit of low-grade temperature. They may not feel up to snuff for a couple of days, but they'll be able to shed this virus a lot easier than those of us with SMA. So I want to give you a couple of tips and tricks that I'm using just to keep myself and my family members and my caregivers safe. Number one, wash your hands many times during the day, okay? Use soap and water or use hand sanitizer, but they say really nothing is better than washing your hands with soap and water. And you need to do this for 30 seconds per hand. So if you got two hands, which most of us do, that means wash your hands for 1 minute, okay? Don't touch your mouth or your nose with your fingers. Try to stay away from doing that, because if you do pick it up on your finger and you touch your nose and your eyes, you're going to get the coronavirus. That's how it spreads, okay? So again, wash your hands. If you have family members that cook for you or caregivers that cook for you, insist that they wash their hands before they handle any food. And if they're helping you eat, again, the cleaner they are, the better you're going to be in the long run. Try to stay away from events that have a lot of people, even 5 or 10 people. You know, they've closed most of the movies down now. I think anything over 50 people, they're required by law right now in the United States that they have to shut things like that down. A lot of restaurants are closing their diners or their indoor facilities and only allowing takeout or carry out, and that's it. You know, I really feel sorry for the restaurant owners. They're the ones that are really going through a financial hardship. But again, this is all in preparation to keep us safe, okay? Now, those of us with SMA already have a compromised immune system and lower lung function. So we need to be especially careful with regards to getting out into the public and possibly getting exposure to the coronavirus. All right, so if you go to physical therapy, talk to your physical therapist. Ask them if it might be wise to forego going to physical therapy for a couple of weeks so that you can keep yourself safe. I went to physical therapy last week, but I just got off the phone with my physical therapist, and we both agreed that maybe I need to stay away for 2 or 3 weeks just to play on the safe side. It's not going to impact me that much. I may, feel a little bit of the effect of not going through physical therapy, but I would rather go through a little bit of discomfort now and know that I'm keeping myself safe. And really, both of my physical therapists that I use are extremely clean with regards to keeping the facility in a clean state, but I don't want to take any chances. If you're planning on going out with your friends, I would probably forego doing that for the next 2 or 3 weeks. Go through a little bit of discomfort now to make sure that you keep yourself safe. Because again, having a compromised immune system, we really need to pay close attention to what we're doing in our day-to-day lives, okay? Now, there's been a big topic about people going to the grocery stores and buying loads and loads of toilet paper and bottled water. Well, first off, I don't understand the toilet paper thing, because diarrhea in and of itself is not a symptom of the coronavirus. And with regards to bottled water, I know some people that only drink bottled water, but me, I don't care. I can drink water out of the tap in the kitchen. I can drink water out of the tap in the bathrooms. When I was growing up, I used to drink water that came straight out of the garden hose. So to me, it really doesn't matter. But, buy enough food to where you and your family can stay sheltered for maybe a week or two, just in case that they impose those limits on us. But again, you don't have to buy 6 months worth of food. It's not going to turn out to be as bad as what you think. Yes, there are countless of thousands of people that are carriers of the coronavirus. Thousands of people have died from this. I'm not mitigating or minimizing anything with regards to my message to you. But what I am saying is use some common sense and don't panic, okay? Now, when they start testing people on a more regular basis, once these tests become more available, yes, the number of people that are diagnosed will probably skyrocket, but they're expecting that. Okay, so just limit the amount of exposure that you put yourself into. I think that's going to be your best bet. Okay, so please, if you would like to, and we would greatly appreciate it, if you'll go to www.smanewstoday.com/forums, and I put that on the video, and I'll also put that in the description of the video. But go and join our forums, because we've got topics that we're talking about regarding coronavirus, tips and tricks that we're using to stay safe. And, it can be for patients with SMA, or it can be for any kind of patient that has any kind of compromised immune system or lower lung function. So it's great information to share with your family and your friends. Talk to your doctors. Make sure that you call your doctor and ask them what you can do to play safe. Talk to your family and just use some common sense. That's really the only thing that we need to do. Hey guys, if you enjoyed this episode of the Morale Monologue, give me a thumbs up. And please subscribe to the SMA News Today YouTube channel. We would greatly appreciate it. Remember, when you do subscribe to the channel, click on that bell icon. That way you'll be notified of any new videos that we produce. We at SMA News Today hope all of you had a great week, have a great upcoming week, and we hope that you and your family stay safe. Until next time, take care of yourself. Bye-bye.